Let's talk briefly about Bell's palsy. With Bell's palsy, it affects the cranial nerve 7, which is the facial nerve, and it eventually produces facial weakness or paralysis. Okay. Now, understand that there are two facial nerves in our face. Most of the patients with Bell's palsy has unilateral facial distortion or facial paralysis. This means that for patients with Bell's palsy, only one side is usually affected. For these patients, they usually have the inability to control their facial muscles on the affected side, right? So for these patients, they usually would have a hard time closing their eyes, hard time smiling, obviously speak. They also have pain around the jaw or the ear on the affected side. Their eyes usually rolls upward on the affected side, and they usually would have some even taste distortion. Usually, Bell's palsy can be diagnosed just by taking a health history and doing a complete physical exam with the patient. The doctor might also do some neurological exam to check the facial nerve function. So what can we do for these patients? Well, most people who have Bell's palsy, they recover completely without treatment, usually within 1 to 2 months. But for a small number of people, they might have permanent muscle weakness or other problems in the affected side of the face. If the doctor suspects that the Bell's palsy is caused by inflammation, then we can give the patient corticosteroids such as prednisone to reduce the inflammation. And if the doctor believes that the virus is causing the Bell's palsy, then the patient would be prescribed an antiviral drug such as acyclovir.